What is sonosalpingogram? Sonosalpingogram is a method to check the patency of the fallopian tubes in infertility patients using ultrasonography. So we spoke about HSG. HSG is by checking it through an X-ray. Here sonosalpingogram means by doing a ultrasound, we are checking whether the tubes are open or blocked. So here we can check whether both the tubes are open or both the tubes are blocked. And here we are using a very simple solution, that is the normal saline, which is nothing but salt water. And we introduce this water into the uterus through a cannula or through a Foley's catheter, which is placed inside the uterus. And then we do the ultrasound, that is the transvaginal ultrasound at the same time, to check whether the fluid, that is the normal saline, is moving inside the uterus and whether it will enter the fallopian tube and whether it will spill into the abdominal cavity. This is a very simple test. This test can be done before the 10th day of the period, because we don't want the patient to ovulate, and then if the egg is in the fallopian tube, we don't want to push it back into the abdominal cavity. And also the patient can get this done either with anesthesia if she is very sensitive, or without anesthesia. So the patient has to come either in fasting if it is under anesthesia, or she can have light snacks or breakfast and then come. It can be done any time of the day, and she has to bring her relative or her friend who is a responsible adult when she is getting this procedure done. And she has to come with like a very relaxed mind. We don't usually give any major pre-medications when we are doing this test, and it is done in any of the ultrasound scan centers or a fertility clinic which will have an ultrasound machine, or even in a clinic where there is ultrasound machine. Procedure is ideally done by a gynecologist who has the license for ultrasonography, or by a radiologist. So on the day, we take her inside, we clean the vagina with an antiseptic, and we put the catheter inside the uterine cavity, and then we push the saline. At the same time, we keep the transvaginal probe in the vagina to check whether the fluid is entering the cavity and whether there is spill or not. So this will be slightly uncomfortable for the patient when we are actually injecting the saline. And during this time we can give her a painkiller tablet or a suppository to relax the uterus, and this will help in relieving her pain. So once we know that the tube patency is there or it is not there, then we will remove that catheter. She will have watery discharge for 24 to 48 hours. There may be slight cramping, and the patient will be prescribed antibiotics and painkillers for 3 to 5 days. So she can resume her activities immediately after the procedure is over, and she will be able to start her, in case if she is working from home or if she is going to office, she can do that after 1 hour after the procedure. She can eat immediately and she can get back to her activities the same day. So there is no restriction on the activity. So the sexual activity also can be resumed on the same day or the next day, and again there is no restriction on that. The same cycle the patient can try for conception, that is if she conceives also, there will be no problem to the fetus, because this is ultrasound and it is not an X-ray which can harm the gametes. So since it is the ultrasound, so there will be no after effects, there will be no side effects to the patient, and this is a very simple one. The report we will get immediately, and based on the report, which can be either that both the tubes can be open, which is a normal report, both the tubes can be blocked, that means it is an abnormal report and she will require further testing, or it could be one of the tubes may be open and the other tube may be blocked. So these are the interpretation of the sonosalpingogram, and how we tackle it, I have explained it in the other video. So this is about SSG, which is a very, very simple outpatient procedure, non-invasive one, and the cost of this SSG may be around 7,000 to 10,000 rupees, depending on in which city you are doing and also who is doing the procedure. This will help us in establishing the tubal patency, which is again a problem in infertility women, where the tubal factors can affect the fertility in a big way. So thank you very much.